необходима ли вообще, в принципе, такая процедура, потому что в атласе по ультразвуковой диагностике есть небольшая глава по поводу УЗИ, в принципе. Ну, пока по поводу УЗИ.
Yes, we can use ultrasonography in diagnosing it. I think maybe a CT scan is going to give us more information, but with ultrasonography we can also see the changes in the soft tissues. How can I say? It's changing the soft tissues by thickening of the planes and that kind of situation. We can also see accumulations of saliva. We can also see some stones using ultrasonography. So yes, ultrasonography is a very good diagnostic tool, but I think in the long term the better tool will be the CT. But yes, we can use ultrasonography.
Спасибо. Следующий вопрос по поводу сиалографии. У меня был опыт маленьких пород собак с сиалографией. К сожалению, у меня ничего не получилось. То ли руки у меня не из того места растут, то ли действительно там были слишком маленькие слюнные протоки для того, чтобы контрастировать. Это были йоркширский терьер, чихуахуа, той-терьер. В общем, удается ли вам в своей практике контрастировать у маленьких пород собак слюной проток? И если удается, поделитесь, пожалуйста, опытом, как вы это делаете.
И какой контраст они вводят туда в качестве?
Ну, амнипак на самом деле очень хорошо подойдет.
Yes.
По поводу контраста спросили, какой контраст вы вводите. Я сказала, что я пользовалась амнипаком, и поскольку его нужен небольшой объем, это не так дорогостояще выглядит из разряда для владельцев.
Yes, you can use Omnipaque or Urographin or one of the other contrast medias that you would normally use intravenously. You can use in the salivary tissues as well. But getting back to your question about how do you find the punctum, you have to use magnification. If you don't have magnification, you're going to find it very difficult to find the punctum. Also, you need very small forceps to be able to support the soft tissue when you put the catheter inside. I wear spectacles, and to put a magnification on the spectacle every time is difficult for me. So I went to my optometrist and I said, please put magnification in the bottom of my lens. So my normal spectacles have got additional magnification, so I can use them to look for the punctum. The other thing that we can do is when we are looking for the punctum to place the catheter, we can try and milk some of the saliva. So you know where the duct is, you can push the duct and you can have a look to see where the saliva comes out. And where the saliva comes out, you put your catheter in. It is very difficult in the small breed and also in the cat. The cat is also difficult to find it. But I think if you use, maybe in the smaller breeds, we can go to the yellow catheter, the very fine one. I think it's a 24 or 25 gauge catheter. We can use that. But yes, it's a challenge. We have to look very carefully for the punctum to put the catheter inside. Please be careful when you are using contrast medium that you only put the contrast medium into the catheter. I know it sounds stupid, but sometimes we have an accident and the contrast medium spills out before we put the syringe on the catheter, and then there's contrast medium all over and we cannot see where we are. So be very careful that you put your catheter in first and then put the syringe with the contrast medium on the catheter without spilling any of the contrast medium.
Спасибо, я поняла. Еще у меня есть вопрос. Какие относительные и абсолютные показания для удаления слюнных желез? Бывает, скажем, не то чтобы часто, но и нередко, когда мы наблюдаем консервативно из разряда лечим пациентов при мукоцеле либо сиалоцеле, не торопимся удалять слюнные протоки вместе со слюнной железой. Вот, то есть расскажите, пожалуйста, абсолютные и относительные показания, когда можно консервативно полечить, а когда точно нужно удалить, чтобы не ошибиться.
Okay, so I think an absolute reason to remove a salivary gland is if there's a tumor. So if there's a tumor in a salivary gland, you have to remove it. you need to warn the client that there might be collateral damage. In other words, there might be damage of nerves in the area, which means that the animal might have nerve deficits afterwards. But that is what we expect if we want to cure the animal by surgical resection. So that's an absolute indication. Another absolute indication is if we have a ranula that we've marsupialized and the ranula returns, then it's an indication we must go and take the salivary gland out. We said that the mandibular and the sublingual glands share a capsule, so we cannot remove one gland without the other. And in that case, the indication is to take both glands and actually the two components of the sublingual as well as the mandibular gland as well. So the whole lot have to come out. If we have a sialostool or a mucosole that is subcutaneous and the animal appears to be comfortable, so there's no pain, there's no enlargement, and there's actually some decrease in the size, then we might want to wait before we do surgery. Because if it reduces in size, it's possible that there was an obstruction, a sialolith maybe, that has then moved, and the salivary gland is now producing saliva at a rate that can flow normally into the mouth, and it's not accumulating under the skin. In that case, we might wait a bit. I said right in the beginning at the anatomy part of the lecture that if you take out one or two salivary glands, or even if you take out, let's say you take out the glands on one side, and after that you find that there's still a sialostool, and then you find actually it was the other side that was involved, and you go and take those glands out, that animal will still not develop xerostomia, even though you've removed 6 glands. The animal's production of saliva through the other glands is still sufficient. So if we unfortunately make a mistake and take the wrong gland out, we're not going to reduce the saliva flow to such an extent that there's a problem. Some clients prefer to go conservative. I understand that, as long as it's not to the detriment of the patient. If the patient can cope with it, there's no problem. We can do that. Removing the salivary gland most of the time will cure the problem. But we need to make a good diagnosis. So we need to know which gland is involved, remove that gland, and then we'll have a good response. One day I was at a clinic where an animal had a swelling on the side of the face, and we did contrast, and it looked to us as if it was the sublingual and the mandibular gland. So we did the surgery, removed those glands, and the symptoms still stayed there. Did further investigation at a later stage, and then we determined that maybe it was the parotid. So then the parotid was removed, and that resolved the issue. So it is sometimes difficult to determine which one, because you can put contrast medium in the duct and find that it goes to an area that makes you think that you have a problem, and it might not be. And in that case, I think maybe a CT, a contrast CT, might have been a better diagnostic modality.
Я поняла, спасибо. Тогда встречный вопрос по поводу консервативного лечения. Если владельцы настоятельно, предположим, отказываются от оперативных действий и хотят понаблюдать за, в общем-то, состоянием животного и так далее, какие препараты вы назначаете касаемо анальгезии, если это необходимо, какие лучше всего действуют на боль, так сказать, слюнных желез в целом, назначаете ли вы антибиотик, и какой антибиотик лучше проникает, соответственно, в слюнные железы, и назначаете ли еще какие-то препараты дополнительно?
If there is pain and discomfort and we feel that the animal needs an analgesic, then we can use a non-steroidal analgesic, something like meloxicam or something similar to that. In dogs, we can also probably use some other medications. Do you have opioids? Do you have opioids? Yeah. Okay. So we can use opioids as well in small volumes. If we feel that there's a need for antibiotic, we need to qualify that need. Okay. We should not just be giving an animal antibiotic because we think it's going to be beneficial. We need to determine that there's a problem that will respond to antibiotic. In that case, we can use antibiotic, and a potentiated penicillin is probably one that we'd be quite comfortable with using. We need to be careful that we don't use an antibiotic that is actually going to affect the production of saliva. There are some antibiotics that can do that, so we need to just keep away from them, but mainly potentiated penicillin is probably going to be a good one. Maybe doxycycline also would be good.
Спасибо большое. На все мои вопросы ответили.
Can I just add one more answer there? I think that we need to help our clients understand that if we tell them that a specific treatment is required, then that specific treatment is required. Okay, it is. We make a diagnosis and we say this is the treatment. If they choose not to have the treatment, sometimes they come back and they tell us that we didn't do the surgery, but they elected for conservative treatment. So we need to have the client understand at the time that if surgery is indicated and they choose not to do it, maybe we must have them sign a piece of paper that says they told us not to do the surgery. Okay, because conservative treatment sometimes is not the best treatment.
Спасибо большое. Я очень рада, что вы ответили на мои вопросы. И, в общем, все мои вопросы разрешились. Коллеги, у кого-то еще появились вопросы?